Which landmark of the humerus do you think is the most clinically important? The surgical neck, deltoid tuberosity, or medial epicondyle? Welcome! This is Anatomy Made Easy with Ekechukwu Dora Ozioma. Hold on to your answer to that question, because now we're going to be talking about the humerus. So, hold on, and you will answer it after we're done. Yes, the humerus is the long bone of the arm, the only bone of the arm. It connects the shoulder to the elbow. Now, this is the head of the humerus. As you can see, it is smooth and rounded, and it forms the proximal articular surface. The head of the humerus faces medially, superiorly, and slightly posteriorly. It articulates with the glenoid cavity of the scapula to form the glenohumeral joint or shoulder joint. This shoulder joint allows a wide range of movements. The head of humerus is a common site for proximal humeral fractures, especially in elderly patients with osteoporosis. This is the anatomical neck of the humerus. The humerus has two necks. This one is one of them. As you can see, it lies just immediately around the head, and it's constricted. It serves as an attachment point for the capsules of the shoulder joint. It is less commonly fractured, but very important for identifying the boundary of the humeral head. This is the greater tubercle. This greater tubercle lies on the lateral side, and it is a large projection just close to the head of humerus. Rotator cuff muscles, 3 rotator cuff muscles attach on it. We call the rotator cuff muscles the seats. 3 of the seats attach here. The supraspinatus attaches on the superior facet, infraspinatus attaches on the middle facet, teres minor attaches on the inferior facet. They provide leverage for shoulder rotation and stabilization. Avulsion fractures can occur if there is a forceful contraction of these rotator cuff muscles. This is the lesser tubercle. It is smaller. The projection is smaller and located medial to the greater tubercle. The last seat, subscapularis, attaches here. It is responsible for medial rotation of the arm. It is an important landmark during shoulder surgery and imaging interpretation. Here is the intertubercular sulcus or bicipital groove. It is a groove lying between greater and lesser tubercle. So, we have the structures that you can find in the bicipital groove. The long head of bicep brachii, the tendon of the long head of bicep brachii, we pass through here. On the lateral lip, the pectoralis major muscle attaches. On the floor, latissimus dorsi attaches. And on the medial lip, teres major muscle attaches. So, with the long head of bicep brachii, pectoralis major, latissimus dorsi, teres major, all on the bicipital groove. So, if there is bicipital tendinitis, it occurs and inflames the tendons of these muscles. Here is the surgical neck, the second neck of the humerus. You can see it's narrow and distal to the tubercles. It is the most common site for fracture of the humerus. If the fracture occurs on the surgical neck, the axillary nerve and posterior circumflex humeral artery will be at risk or affected. So this surgical neck, as you can see, it is a pathway from the proximal part of the humerus to the shaft. This is the shaft of the humerus. You can see that the upper part is cylindrical, but as you go down, it becomes what? Triangular. It provides attachment to muscles that move your arm. Here is the deltoid tuberosity. It is rough and triangular and lies on the anterolateral part of the shaft. The deltoid muscle attaches on it, allowing powerful abduction of the arm. Deltoid muscle is prominent in athletes due to the strong deltoid activity occurring. So is the deltoid tuberosity. And remember, deltoid muscle is a site for intramuscular injection of warm meal. This is Anatomy Made Easy with Ekechukwu Dora Ozioma. If you have not subscribed to our pages and channels, check us on TikTok, YouTube, and WhatsApp channel. They all bear the same name, Anatomy Made Easy. Like, share, and subscribe to this video. The humerus also has a nutrient foramen, a small opening on the shaft where the nutrient artery goes in to supply the bone. Also, if there is damage to the nutrient vessels, it can delay the healing of the bone after fractures. So look at the shaft on the anterior view of the humerus. The brachialis muscle attaches here. It is the primary flexor of the elbow joint and an important muscle used in lifting and pulling. This is the supracondylar ridges, medial and lateral. These supracondylar ridges are above the condyle. This medial ridge gives attachment to pronator teres muscle. Lateral ridge gives attachment to brachioradialis muscle. They are landmarks for identifying supracondylar fractures in children. Here is the medial epicondyle. It is a large projection and lies on the medial side of the distal humerus. Some muscles attach here. The flexor muscles of the forearm. This is where they attach or originate. Flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis. Ulnar nerve passes behind this medial epicondyle. So when you hit this part of your arm, it gives you that funny bone sensation due to the ulnar nerve behind it. Here is the lateral epicondyle, a smaller projection and lies on the lateral side. The extensor muscles of the forearm attaches on it, like extensor carpi radialis brevis and extensor digitorum muscle. So this lateral condyle is usually associated with lateral epicondylitis, also known as tennis elbow. Here is the capitulum, this rounded lateral articular surface here. It articulates with the head of the humerus, allowing flexion and rotation of the arm. This is the trochlear. The trochlear, as you can see, is on the medial articular surface. It articulates with the trochlear notch of the ulna. It is responsible for the hinge movement at the elbow joint. This is the radial fossa. This small depression here above the capitulum. It receives the head of the humerus during elbow flexion. And here is the coronoid fossa. This depression above the trochlear. It accommodates the coronoid process of the ulna when you flex your elbow. Coronoid coronoid process is an important landmark during imaging of the elbow and assessment of elbow what? Fractures. Oh yes, what have you learned so far on Anatomy Made Easy with Ekechukwu Dora Ozioma? We have seen that the humerus has a head, anatomical neck, greater tubercle, lesser tubercle, intertubercular sulcus, surgical neck, common site for humeral fractures, deltoid tuberosity, nutrient foramina, brachialis attachment here, medial supracondylar ridge, lateral supracondylar ridge, medial epicondyle, lateral epicondyle, capitulum, trochlear, radiofossa, and coronoid fossa. Now, tell me, which landmark of the humerus do you think is the most clinically important? Is it the surgical neck, deltoid tuberosity, or medial epicondyle? Drop your comments below. See you soon. Stay tuned. Bye-bye.